I was just at the dentist's office the other day, and while I was walking in, I noticed there was a sign on the door and on the counter that said that certain Medicaid and Medicare insurances would not be covered and that patients would need to cover those prices in cash on their own if they were a member of these listed insurance companies. So I signed in and I was sitting in the waiting room, and I heard the women who worked on the office answer the phone and talk to a potential patient and was explaining their policy of not accepting Medicaid and Medicare insurances. And so after she got off the phone, she spoke to her other office mate and basically welfare shamed this patient and said, you know, this patient is in pain, but she doesn't have a job and she doesn't have dental insurance, and she should just go get a job that has dental insurance if she wants such coverage. And so I just wanted to talk about this little story to talk about the concept of welfare shaming, and that in the United States, it's very popular for the people to blame those living in poverty for using social benefits, when in reality, the majority of welfare in this country goes to the corporate elites. It goes to supporting corporations, funding businesses, bailing out businesses, providing subsidies to industries, and extreme tax cuts for corporations and the wealthy. If the rich people paid their taxes like the poor people do, then we would have funding to support all of our social services. I love sociology as a discipline because your sociological perspective can shed insight into one's daily activities. And so in this video, I just wanted to use that opening vignette of the welfare shaming happening at my dentist's office to talk about the larger national picture of how people that are perceived to be receiving social benefits are shamed. The majority of our welfare is funding the super rich, the top 1%, the top 10%, and industry and businesses. So this is really just a way to scapegoat and divide people along class lines, when in reality, the real people that are cheating the system, and corporate persons is one of them. So it's really the rich that are taking the corporate welfare, and the poor are the ones denigrated for this. And we just have to ask ourselves, who does that serve? So being a sociologist, I had to dig into the numbers and look into this story. The first important point, of course, is that we live in a so-called developed country, a so-called the richest country, and yet we're the only developed or rich country that does not provide health care to its population. We're the only so-called rich country that has a for-profit healthcare system in which many people are excluded and many people simply cannot afford to get healthcare treatments that they are in need of. And so I looked up some numbers and found that there are 76.5 million Americans who are uninsured. Now, what I also learned is that by law, children are required to be covered by dental insurance, and so this includes state-provided dental insurance. And therefore, children have higher rates of receiving the care that they need, whereas there is no requirement for states to provide dental health care, even through Medicare and Medicaid, for adults. It's up to the states to decide. And so looking at these numbers and seeing the percentages of Americans who do actually seek dental services each year, a lot of Americans are just foregoing treatment, and that this can lead to very serious health outcomes in the future. Thinking back to the conversation that the women were having at the dentist's office, the women who work in the office there, and their stigmatization of people utilizing Medicaid and Medicare dental coverage, I received another email in this ongoing email thread at my school among the faculty and staff, where they're very unhappy with the change that the school made in our insurance policies. The point is that I am a full professor and that this is my insurance coverage, and that even in my position, people are very unhappy with the coverage that we receive. And so thinking about those those dental office workers who were shaming the people because they don't just go get a job that has proper insurance. And I have insurance that a lot of people in my workplace are complaining about. And so a lot of people have no health care coverage at all. They don't have a full-time job. They're kept underneath the bar for full-time so that they don't receive these benefits. And then when they do receive the benefits, they might have to really pay a big part of that, and the benefits may be inadequate, and healthcare coverage and dental coverage and vision coverage may be inadequate. And so this is a real issue for all the people in the United States to really pay attention to. And I think that as a sociologist, it's really important that we look at these umbrella social issues that impact the most amount of people. And so one thing that could change in these outcomes is that the federal government could require states to provide dental coverage to its residents. And so that would be a policy change that would affect millions of people nationwide and really relieve their dental issues. So I think it's just really important that we push back on this narrative of welfare shaming and blaming the poorest of our community members, when really it's these corporate elites and the top 1%, and especially the companies that are getting the subsidies, getting the bailouts, getting our taxpayer money. So this is a serious situation in the United States that needs to be addressed.